Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to the presentation on orthostatic hypotension in dental setting. Orthostatic hypotension occurs when a person stands up from the sitting or lying down, causing a drop in blood pressure. This is also known as a postural hypotension. This happens because blood pools in the lower parts of the body, that is the periphery, and is not quickly returned to the heart and brain, leading to temporary decrease in blood flow to these areas. Understanding this helps in managing patient safety effectively. Orthostatic hypotension occurs due to blood pooling in the periphery, not remobilizing quickly enough when standing up. This can lead to reduced blood flow to the brain, causing lightheadedness or fainting. Symptoms include palpitations and general weakness. To manage orthostatic hypotension, have the patient recline until symptoms disappear. They should then sit up slowly on the edge of the chair before standing. Blood pressure should be monitored in the different position to ensure safe recovery. There are certain risk factors. Age, medications predispose patients to orthostatic hypotension, including diuretics, antihypertensives, and narcotic analgesics. Psychiatric drugs and beta blockers like propranolol can also contribute. You must consider some additional consideration. The patients with the risk factor should be allowed more time to stand gradually. In cases where long-acting narcotic analgesics were used, an naloxone may be required. Severe cases should be referred to a physician for a possible medication adjustments. These steps of management of orthostatic hypotension are provided in your textbook. Let's recap some important points. This condition is defined as a temporary change in the state of consciousness due to the postural changes. This leads to cerebral ischemia when a patient rapidly stands up. This can cause dizziness, feeling of lightheaded, palpitations, weakness, or fainting. Patients should recline until symptoms resolve before slowly sitting up. Blood pressure should be monitored in different positions to ensure stability. Medications like diuretics, antihypertensives, narcotic analgesics, and beta blockers can increase the risk of orthostatic hypotension in patients. Patients should stand up slowly, taking breaks to let their cardiovascular system to adjust. Those with severe hypotension should consult their physician for potential medication adjustments. Naloxone may be necessary for patients sedated with long-acting narcotic analgesics. To conclude, orthostatic hypotension is a common cause of temporary altered consciousness in our dental settings. It is crucial to manage it properly to ensure patient safety. Recognizing symptoms and managing them safely is the key. Thank you. Wish you best of luck.